now to the latest on the pandemic. COVID cases and hospitalizations are dropping sharply across the country as more than 1 million Americans have been vaccinated daily for the last 12 days. But concerns are growing over new virus variants. Dr. Anthony Fauci says they should be our top concern in the U.S. and that the next 6 weeks will be critical in preventing their spread. So will current vaccines protect against these new mutations? Let's bring in Dr. Drew Weissman. He's a professor of medicine at the University of Pennsylvania who developed the mRNA vaccine platform used by the Pfizer and Moderna vaccine. Dr. Weissman, good morning. Thank you, or good afternoon, I should say. Thank you for being here. When it comes to trying to adjust for these new variants, how feasible is it to manipulate the current vaccines if you find they don't protect as well against these new mutations?
So we're not at that point yet. The vaccines still work. The worry is that they soon, or in the future, they may not. For the RNA vaccine, it's very simple. You simply exchange a new antigen, a new spike protein in the mRNA, and produce it. According to Ugur Sahin, the CEO of BioNTech, that will take them 6 weeks before it'll be ready to give to patients. So that's incredibly quick.
So it's easier, it sounds like, to manipulate the mRNA vaccines, this new version of vaccines, than it would be to do the same with if these vaccines were done in a more traditional format?
It would, because making the RNA is quick and it's simple, whereas these other platforms would require more optimization, more testing, more development.
And so what kind of work is being done right now to try to make sure that these vaccines continue to be effective?
So I know that both Moderna and BioNTech Pfizer are already working on a potential booster vaccine that will cover the South Africa and other variants.
Now, we have already seen some hiccups in vaccine distribution and administration here in the U.S. So is vaccine distribution infrastructure prepared to administer not only the initial versions of the vaccine, but then also any future booster shots we might need?
So that's actually a good question. We're certainly improving. The amount of vaccine, the ability to distribute it, to give it to patients is improving from week to week. And I believe it's going to continue to improve.
Now, a peer-reviewed study released today found that Russia's vaccine is over 91% effective. Could we start to see that vaccine used here in the U.S.?
I mean, that's great for a vaccine efficacy. I don't know where the Russians are going to distribute it.
All right. And lastly, Dr. Weissman, we know that there is a lot of mistrust in vaccines in general, particularly these, because it's a new virus and a new vaccine. But one of the concerns is that the mRNA platform itself is new, and that has people worried. What do you say to people who worry about that aspect of the vaccine?
So it's not new technology. We've been working on mRNA for 30 years. We've been working on mRNA vaccines that are essentially identical to the COVID vaccines for about the past 9 or 10 years. They've been in people for over 6 years. This is not a brand new vaccine. It's well-established technology. The vaccine has been shown to be incredibly safe and very, very effective.
All right, Dr. Drew Weissman from UPenn, we appreciate your time and your work. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.